Hello, my name is Lindy Sasser, and I'll be presenting on the impact of tuberculosis on HIV positive people in the United States. These three pictures of Vivian Lee that played Scarlett in Gone with the Wind, Eleanor Roosevelt, and Doc Holliday portrayed in the movie Tombstone all show that tuberculosis can infect anybody at any given time. It's not a respecter of age, gender, socioeconomic status, or anything really. Absolutely anyone can test positive for tuberculosis at any time. Our student learning objectives include discussing the pathophysiology of tuberculosis, including the signs and symptoms, specific impact of tuberculosis on HIV positive in the U.S., the levels of prevention against tuberculosis, the role of the advanced practice nurse in addressing the needs of the tuberculosis patients, explaining activities that demonstrate the role of the advanced practice nurse in levels of prevention against tuberculosis, discuss the cost of screening tests, as well as effectiveness of them on preventing tuberculosis, and identifying potential for unintended consequences of screening and weigh the benefits against potential harm. So a little bit about the pathophysiology of tuberculosis. It's a chronic respiratory infection that's caused by the bacteria Mycobacterium tuberculosis. It's spread by airborne droplets that most commonly infect the lungs, but it can also become extrapulmonary tuberculosis, and that infects the eyes, skin, meninges, lymph nodes, skeletal system, gastrointestinal or genitourinary system. Infection occurs when a person inhales the droplets that contain the bacteria and it reaches the alveoli of the lungs. The body's system starts to fight off the bacteria, but it often solidifies within the body in a scar-like manner, becoming what's called dormant tuberculosis infection. The signs and symptoms of TB are fever, a cough that may be non-productive or dry, mucopurulent, containing mucus and pus, or hemoptysis, having blood in the mucus as well, night sweats, fatigue, anorexia, and weight loss. So how common is HIV and TB co-infection? Tuberculosis is one of the leading causes of death among those that have HIV worldwide. Those with untreated or the latent TB and HIV are much more likely to develop active TB during their lifetime than those without HIV infection. Between 1993 and 2020, the cases of TB have declined by 88.4% among U.S.-born persons, and men account for 60.8% of the TB cases in the U.S. in 2020. That goes with this careful use of medications, decreasing those numbers significantly. So the three levels of prevention against TB include primary, which involves understanding the risk factors of TB to remove those factors from causing infection to occurring. Secondary, involving early disease detection and treatment. And tertiary, involving interventions that are aimed at slowing the progression of the infection. So primary prevention could include regular screening and testing of those that are at high risk of contracting TB, especially those that are already HIV positive. The BCG vaccine, covering mouth and nose when sneezing or coughing, frequent hand hygiene, and educating those that are in the at-risk populations on prevention, including those that are healthcare workers and those living in crowded areas like in a dorm room or a nursing home. Secondary prevention is going to be the early detection coming from testing, especially those that are at risk for HIV. Those with HIV should be tested for TB, and testing can include the Mantow PPD, which is a skin test that goes intradermally, and it's read within 48 to 72 hours on the induration, which means the hardness that potentially comes up from a reaction. If there's a positive PPD test, it's followed up with a chest x-ray to verify whether it was positive or not, looking for consolidation in the lungs. Rapid blood test can include the quantiferon TB test, and that looks at the reaction of the white blood cells in the body against the TB infection. And sputum culture and sensitivity looks at whether TB is present in the sputum. So tertiary prevention focuses on treatment and slowing of progression, so to prevent future spread or development of the disease, and that this is going to use medication therapy, which is a combination of isoniazid or INH, rifampin, pyrazinamide, and ethambutol. Those that are HIV positive should speak to their doctor about starting these medications for TB treatment while taking their HIV meds. And they should be educated on potential side effects of some of the medications, like rifampin causing tears, sweat, saliva, bodily fluids to look a yellowish, reddish orange color, as well as the fact that they're probably going to start feeling better pretty soon after starting the medicine, but that they need to complete their treatment regimen for total treatment and prevention of future sickness. So the role of the Adpn includes educating the community on TB. That's the transmission, prevention, testing, and treatment of that, focusing primarily on those high-risk populations that we talked about earlier, especially those HIV positive or at risk for contracting HIV, those living in college dorm rooms or nursing homes, and healthcare workers. Educating facilities that provide care without insurance requirements for those in low income situations, and partnering with community leaders to provide programs for those with HIV-TB co-infection. A big deterrent of seeking care is those that have low income and no insurance, because they think if they go to get treatment, then they won't be able to afford it. So what's the point in that situation? Activities to promote education in communities can include health fairs, visiting high schools, colleges, nursing homes, churches, to speak at different assemblies, setting up testing clinics, following up on maintaining medication regimen, and activities to promote education in healthcare facilities are to create needle safety and TB protocols. So the needle safety would be to prevent stick injuries that could introduce HIV infection from blood, and then TB protocols, which are going to include providing PPE, N95s, gowns, protective eyewear, gloves, and negative pressure rooms, so that the air is not circulated through the air ducts, but it goes out to the outside, while isolating those patients to prevent the spread of TB infection. The cost of screening tests for TB and HIV can be a deterrent as well for those that don't have insurance. A PPD test is $32 average for those without insurance, and blood testing is about $71. And HIV testing, depending on the extent, can cost anywhere between $128 to $429 without insurance. At-home tests are around $46 that you could get at a drugstore. With insurance, the testing is normally covered by the cost of the copay after meeting the yearly deductible when ordered by a physician. Potential for unintended consequences of screenings are no follow-up care, which could be from embarrassment, lack of funds being able to go and have treatment, inappropriate treatment or false positives, and increasing the stigma and discrimination, which also deters people from seeking care. Benefits of screening include early detection, early treatment, prevention of spread of infection, and the promotion of longer, healthier lives. And here we have references which include the American Lung Association, the CDC, as well as some pictures and Wikipedia with some of the pictures here. So thank you very much.